Dr. James Briles. I'm a board-certified family physician. I've been in practice in Palmetto, Florida now for over 30 years. About 4 months ago, I had the good fortune to be introduced to Dr. Ron Gilbert and a wound care technique that he has developed. Since that time, I've had patients who have been treated by Dr. Gilbert with absolutely amazing results. I think we currently are sharing 5 or 6 active patients, all of whom have had complicated wound histories. These patients have had wounds that have been recurrent or chronic long-term. They've failed other treatments, and the treatment plan is now to the point where it's included discussions about amputations and aggressive surgical interventions. Since Dr. Gilbert has been treating these patients, the surgical word has fallen by the wayside, and the healing results are just amazing. These patients are complicated. They've had long-term wound problems. They also have complicated medical histories, including diabetes, peripheral vascular disease, hypertension, chronic renal failure, heart disease. They're on multiple medications, and they have significant limitations to their mobility. And despite this, we're seeing wonderful results with Dr. Gilbert's technique. Wound care is becoming a big issue, and we're finding a lot of chronically infected, chronically non-healing wounds in these complicated patients with these complicated medical histories. And what I've seen more is the response in the wound itself is just amazing. The difference you'll see between a terribly necrotic, ugly-looking wound, and after a treatment or two or a week of treatments from Dr. Gilbert's technique, the wound is clean. There's granulation building in. The wound is shallow. It's clean. The edges look much improved. It's just an amazing progress in a short period of time. One of the most recent patients that we've shared is a patient at a nursing home who has had surgery, has lost digits, and has amputations. His wound, from the time that I saw it initially, when I referred him to Dr. Gilbert, and compared to 1 week later, was an amazing difference. I haven't seen anything out there, and including the standard of therapy for wound care that we see locally has been employed, once again with the debridement, the hyperbarics, the antibiotics, the topical treatments, that even comes close to what Dr. Gilbert's accomplishing with his technique. I find Dr. Gilbert to be a very intelligent, caring healthcare professional whose technique is not complicated, it's easy to administer, it's painless, and as I mentioned, the results have been just absolutely amazing. This has been a delight for my patients, and Dr. Gilbert's very enthusiastic and extremely happy about the care that he can give these people who basically in some cases were pretty hopeless in terms of ever getting their wounds healed. Beyond the direct wound care itself, his technique employs nutritional support as well as mobility, both very important for the healing of these chronic wounds. I would encourage anyone out there with this type of wound, or any physician who is having a patient with wound care issues and non-healing of wounds despite the aggressive treatment, to give Dr. Gilbert a call. You'll be extremely pleased and happy about the results.